Well, I'm Dr. Wayne Hollar. I practice in Lenoir, North Carolina, and I have been a loupe-mounted camera user for a long time, starting in 2007. The advantages that you get from using the camera and being able to show patients what you see, there's just not any other way to do that. So the communication is just unbelievably improved because there's no question, what I see. So when doing the exam, the hygiene exams, again, I can point out with the Mirror and Explorer, just like I always do, things like decay or fractures or stain or calculus or whatever it is that I see. I can point those things out with the Mirror and Explorer, and the patient sees that just like I see it because the camera is on those issues. And that opens a dialogue. If the patient has questions, they can ask questions. So it just gives that patient a visual understanding of what they hear us talking with the hygienist about all the time. But it also helps that patient take a little bit of ownership of that problem. If we show them the problem we show them that fracture, if we show them that decay, they don't feel those things usually. They don't know it's there. They hear us talk about it, and I'm sure in their mind they're saying, yeah, right, that doesn't hurt. But when they see it, when they see a big fracture, or they see a silver filling that's just badly leaking and it's black and ugly, they see those things, they take a little bit more ownership of that. So that's in hygiene, that's how I use it. But the patient is in for a problem-focused exam. A patient comes in with a toothache, or a patient comes in with a broken tooth or a missing filling or something. But when I get to the point where I actually look in the patient's mouth to see for myself what it is that they're describing and what their complaint is, then I plug the camera in, set the patient back, and have the patient to watch with me overhead as I look at whatever the problem is that I'm going to address. Sometimes that helps the patient see what the problem is, helps the patient see the fracture or the missing filling or whatever, but sometimes it also helps to kind of put that patient at ease a little bit, because a patient that is in pain is very anxious, does not want that area to be touched, does not want that area to be pressed. And by seeing what I'm doing with the Mirror and the Explorer, only retracting the cheek or retracting the tongue or something, the patient can see that I'm not going in there aggressively. I'm not going to, we're not going to do something that's uncomfortable. We're just looking. And so the patient can see what we can see. And then it sometimes can also help me point out if it's hard, an area that's hard to pinpoint, an area of sensitivity or something. I can put the Explorer on it and say, is this your problem? No, it's over here. And then I can move. And so they can sort of help me co-diagnose a little bit of what's going on, because again, that patient can see in the mouth exactly what I see.
He diagnoses a crown or maybe bridge work, or he's trying to explain something that's a little more complex than just a filling. The camera helps him in that area explain, why it needs to be done the way it's done, and it's in their own mouth, so it's easier for them to see. They'll indicate they want to speak to him. Then they'll say, what's that yellow spot? So they are very much into their own exam. So it's been a really useful tool.